Good afternoon, everyone. As Lou said, my name is Vincent Ashton. I'm the Executive Director of Health Pass. We are celebrating our 10th year this year, so feeling like that's a nice accomplishment. I'm going to give you just a quick synopsis of some of the stuff going on with Health Pass and health reform, just some of our, I wouldn't even want to say positions about it, but some of our thoughts on that. I think that Troy and Ben have already kind of frameworked this, and we're going to get more as time goes on. But we do believe that individual mandate is going to be good for all, that there need to be penalties for those who are opting out, but as everybody said before, affordable options with certain income ranges must be made available and a sliding scale to help people. New York right now is way ahead of the curve. This has to do a lot with the tireless work of the Department of Insurance. We have community rating already in New York. They're talking about doing it, but to an extent, a modified community rating outside of that. We have guaranteed issue as well, which are two of the kind of big pieces of the legislation that are out there. There's question about a public option. I actually put this together before the Senate piece came out, where we were unsure if there was going to be language about that or not, and whether or not that survives is in question. But at the same time, we think that can be a benefit to all if it's on a level playing field. We do want to make sure that the private sector has the ability to help with ingenuity on certain things, but there have to be some competitiveness against the private sector in order to keep costs in line, and so we think that that's a really good thing. And last but not least is there's going to be something called a health insurance exchange and the role of the health insurance exchange. And in fact, Health Pass is really a health insurance exchange to the extent that we can have one in New York at this time. We are a public-private partnership between the City of New York, the New York Business Group on Health, as Lou said, who's our parent organization, and our partner carriers, Emblem Health with GHI and HIP as part of them, HealthNet Guardian and United Healthcare Oxford, who help us with a sole proprietor product at this time. We are a nonprofit. We have a dual mission. The two missions are to help give small businesses greater access to quality, affordable health care. That's for the small businesses and their employees, and we allow for each individual employee to choose from over 30 different options in the menu of plans that we offer. We also are here to help stem the tide of the working uninsured, and we are meeting that mission. Over the 10 years, we've enrolled over 50% of the employers who enroll with Health Pass had no previous health insurance coverage. So we're finding ways to be flexible and affordable for those companies that maybe weren't able to find a way to finance their health care previously. With the choice model, they can do that. And I'll talk a little bit more about that. So what do? We offer multiple carriers and plan designs to small business employees. We make healthcare more affordable through those choices because people now do not have to purchase those unused benefits that they've had to purchase in the past. There are now times where you've got people who are other carriers who may be tiering, giving you a high-low option. Health Pass gives you over 30 different options to choose from. You can have the person who sits up front, who may be fresh out of college, who maybe isn't established in business, is more concerned about their bills from day to day and doesn't need a rich PPO plan like maybe a partner at a law firm does. At that place where you have such a wide demographic differential, both in status and in need for their health care, they've got the ability to make a choice individually about what they want to direct their funds to. And it becomes more and more important these days, as you find as everybody knows, it's getting so much more expensive. You've got to find a way to allow employees to have a say in the health care because they're paying more towards it as every year goes on. You can't afford to absorb those increases yourself, so as the larger share becomes the employee's responsibility, it's nice to give them a say where that money is being directed to. Employers with Health Pass, we encourage them to define a contribution amount. Give a flat level contribution, let people buy up to a better benefit if they feel that they need that. Employees, again, they choose from a menu of plans based on their risk and budget tolerances. We've got HMOs, EPOs, which is basically a PPO with no out-of-network benefit, point-of-service plans, HSAs, and some of the newer cost-sharing plans where you'll have things like deductibles and co-insurances before the actual benefits kick in. We're a one-stop shop for benefits. We try to put the personal touch back into healthcare. We really make it so that we have our staff accessible to you, that we're almost like an outsourced HR department in some ways on the benefits plan. We are there to help. All of our plans are actually sold through brokers. In New York, brokers are included in the premium, and we feel like they're a great place to start in order to give you kind of an idea of where to go. But at the same time, we know that we can be that further line of support, that direct connection to the carrier. We have value-added services that we add. We give access to a dental plan, a DMO, and a dual option with a DMO and a PPO that normally the smallest of businesses wouldn't have access to. The 2, the 3 employee businesses that have tough times finding something that's adequate and suitable, they are telling you need a minimum of 10 employees or whatnot. We're able to give you access to those kinds of plans through what we do. We also have a security package for employees, and these are voluntary benefits. The DMO, the security package, people can choose just basically on their own needs. Do I want it? Do I not? The security package gives a life product and also a long-term disability product all under one roof for employees to choose from. We are that administrative liaison to the carriers. As I've mentioned, we have a dedicated member services team. We work with an organization called Health Advocate, which works as a third-party resource for employees. They can go to them and they will help them with claims issues, how to file a grievance, questions about things that have to do with even elder care issues for those people. That can be a big drain on your organization if you've got an employee who has an elderly mother or father who lives in Florida or lives close by and they need help figuring out what to do. There's only so many hours in the day that they can do that, and usually it's between 9 and 5. An organization like Health Advocate can step in and really do a lot of advocacy on their behalf. We also have Medical Cost Advocate, which is brand new. This actually works with employees after they've incurred costs. If for some reason they incur a cost that is above and beyond what they were expecting to incur and they don't understand it, they go through the claims appeal, they're denied on the appeals, and they have this bill, what Medical Cost Advocate does is they actually step in between that person and the hospital or the provider and try to negotiate a settled rate so that they have some savings off of what the total amount that they were supposed to pay was going to be. Many times employees, again, can do this on their own. They can go to the hospital finance department, talk about financing it, whatever they may want to do, but it takes time, it takes effort, and a lot of people, I think, feel like they may be better served having somebody who does this for a living doing that on their behalf. We also do all the COBRA and New York State continuation billing and administration for our groups. So we make it nice and easy for them to work on these different things. We take a lot of the guesswork out of it, and since we're integrated with all the different plans, we've been working on their behalf in order to make sure that they get this great benefit. And then also part of just being a Health Pass member is having a Section 125 POP kit. I think a lot of people take pre-tax payroll deductions for the contributions from their employees on their health care, but they don't actually set up the paperwork that has to be done in the background. And so we just make this available to everybody through the website. So, and all of this could be really confusing if you had, 4 different bills and multiple different carriers and lots of different plan designs, but we do it all under simplified administration. We have a 1-page employer application, 1-page enrollment change form that does everything as far as enrolling people, letting them waive out of coverage, letting them elect that COBRA election. We do 1 itemized bill so that you can see each employee and what the different plans that they have are and the related cost to that. We are a centralized source for information, and we believe the one choice to make, the right choice for small business. I do think the last thing I want to see is, they talked about other affordable options in New York, and, Troy and the Department of Insurance is promoting Healthy New York, which I think is a great place to start. There are very, very affordable options through that for individuals, for sole proprietors, and for small businesses. Great place to look if you haven't had insurance before because it is basically subsidized by the state of New York. Brooklyn Health Works, which Troy touched on before, which is actually a private label Healthy New York plan. It is for Brooklyn-based businesses only. As Troy mentioned, there's one in Albany that's coming out as well. And at the end of the day, they actually further subsidize the Healthy New York rate, so it makes it even that much more affordable. Through our products, we have Emblem Compra Health plans, which are limited network plans. Again, as Ben had mentioned, it's very important when you're making a selection on a plan that you understand what you're getting for your dollar. This is a limited network plan. It's got certain hospitals, certain doctors that participate, but not all of them. So you want to make sure that you know what the benefits are and the access that you have to doctors are. Don't just assume because it's Emblem Health that you have the full national Emblem Health network. It is a subset network. Atlantis Health Plans, who's going to talk to you in a couple of minutes, is another great place where you can find really affordable options. And the last thing I'll mention is high deductible health plans and HSAs, and again with that whole understanding of know what you're buying, know what you're getting into. But these are a little bit better for those people who are looking for real low costs on their premium and understand that they're taking on a little bit more of the cost sharing if they do actually go and use services. But for young, healthy people in particular, we sometimes find this to be a great plan solution for them. Again, it's a lot easier to finance a $5,000 deductible that you incur in a year where you have something happen when you're expecting to be healthy than it is to try to finance a $125,000 hospital bill because you didn't bother to get the insurance in the first place. So with that, I think I'll pass it on to Lou, and thank you for your time.